Hi viewers, welcome back. In today's video, we are going to discuss about precipitate labor. Okay. So, what is precipitate labor? Precipitate labor is a very short period of labor. Okay. So, nice to hear. So, always we talk about the long period of labor, like where you go in for first stage of 12 to 18 hours with lot of pain, and then the second stage and then third stage. But this is a nice terminology of precipitate labor where the labor finishes. That is like your first stage and the second stage finishes within 2 hours. Very nice, no, to talk about. Okay. So, however beautiful, so we always say no, beautiful things are very dangerous in this world. So, similarly, the way precipitate labor looks, it is more dangerous. Okay. But we have to talk, this is an abnormal labor. So, coming to the causes, we do not know what is the exact cause of precipitate labor, but sometimes we have an assumption, maybe it is a family character. So, hereditary they are getting, maybe their mother had, and like again their siblings, sisters, somebody is having in their family. So, it is carried on from family. Okay. Or sometimes you can suspect it is because of the uterus. So, it is like special different type of myometrial cells, and like maybe for this particular type of mother she is presenting with this type of delivery. Okay. So, you do not have any exact reason why precipitate delivery is taking place. Okay. So, now then coming to the risks, maternal and the fetal risk, actually complications are very heavy. So, maternal risk first is like see, imagine the uterus is supposed to get trained up. Okay. So, now slowly the contractions have to begin, the uterus has to get trained up, it knows how to push, upper compartment has to send, the lower compartment has to receive, then pushing has to begin, and dilatation, effacement, lots and lots of process are there. But suddenly something is happening to the uterus and it is trying to push the fetus out, then imagine how dangerous it is. Yes, the mother is prone for lot of complication. The first complication is the tear. Okay. So, when the fetus is coming with lots of pressure, what happens? It goes and pushes and tears the cervix and the vaginal wall, and it comes out just like that. Okay. So, the mother will have lot of complications of tear, perineal tear, sometimes vulval tear, anal tear, anything can happen. Okay. So, there is lot of complication in that tearing part. Okay. Sometimes the mother can have a PPH because of like sudden decompression of the uterus has taken place, maybe the contractions have stopped, and because of that the mother can land up with PPH for postpartum hemorrhage. Okay. And sometimes it is rupture of uterus because the uterus is not getting trained properly and suddenly the process is taking place. So, it can lead to rupturing of the uterus. Sometimes it is infection to the mother, sometimes it is because of severe bleeding. So, anything can happen. So, this is from the fetal part. From the maternal part, okay, maternal part, sometimes there is a cord compression, okay, like sudden decompression, and there is a placenta previa or like a cord like vasa previa, and like sudden inadequate perfusion, fetal asphyxia, fetal hypoxia. Okay, all these things. So, fetus can go in for lot of complication, and there may be sometimes there is risk of fetal death also because of precipitate labor. Okay. So, that is with the complications of the maternal and fetal side, and then we have signs and symptoms. Okay. So, what is the sign and symptom of a precipitate labor? Okay. Precipitate labor only it is like unpredictable, signs again it is not predictable. Okay. So, you can see the woman is not getting trained up so fast. The uterus is doing its duty so fast, that is like you are not like predicting anything. Okay. So, the mother will perceive a very high amount of pain than the normal amount of pain. Already we have discussed there will be a heavy pain during the labor process, but now you can't even compare this pain, that much pain she will have, anxiety, okay. So because something like she is not coming to the normal phase only, so anxiety level will be very high and she will be definitely restless. So nasal flaring will be present, where she is having a lot of breathing difficulties, and there will be suffocation. Diaphoresis will be present, there will be an abnormal vital signs, there will be an increase in the heart rate, pulse and blood pressure of the woman, and she will have a lot of discomforts facing during this phase, okay. And then coming to the management part. During the management part, you can divide it into the during the onset phase and during the exact phase of delivery. So during onset, that is like when the precipitate labor is beginning, what you have to do? The woman has started with the labor and you don't know whether she is going to have precipitate labor, but she is proceeding fast, okay. So now what you have to do? You must know there is, like, if you are a good midwife, you will be knowing how the woman will proceed into labor, okay. So by the time she is proceeding fast, if you have an idea, maybe in the beginning she has to admit only tip of the finger, and like after that she has to come to 2 centimeter, then 4 centimeter, like that it has to come. Instead, this is happening very fast, then you must have an idea the woman is going to have a precipitate labor. Then what immediately you have to do it? You have to stop your oxytocin drips, okay. And like first is like you have to stop oxytocin and you can start with your tocolytics, okay. You can give terbutaline or ritodrin, you can start. So anything, sometimes it is effective, they may stop contraction or control the contraction levels, okay. And you will not go in for an amniotomy, okay. So rupturing again can fasten up the labor process. So continuous observation of the mother you have to do. So anytime she can deliver, that is like so fast it is coming down. So you can wait for the baby anytime, okay. Never allow the mother to walk, she cannot get down from the labor table, okay. And in case if there is a like precipitate labor, there may be an abruptio. So sometimes there may be a rupture also you have to suspect. So you have to be very vigilant during this phase, and again you have to see to that you are not inducing stripping, you are not supposed to do. And in case if you are going to do a pervaginal examination, don't do pervaginal examination here. If you are suspecting a precipitate labor, take the mother to the theatre. Like if you are planning for a cesarean session, go there, on the table only you do a pervaginal examination. Never do a pervaginal examination, sometimes that becomes a stimulant and she will deliver very fast, okay. So these things can be done in the preparatory phase, that is like just before the labor. You are thinking, you are having an assumption that she is proceeding fast, you will stop these actions like this, okay. So now the woman has proceeded into labor, now she is about to deliver. So what all you can do? So you can again, like you can continue with your tocolytics, and like you can like you are not supposed to give your oxytocin drip, and then you have to have a controlled support over the perineum. So when the head is coming out with lot of pressure, you can give your perineal support. So perineal support can be given so that the tear can be restricted. So like you can control the perineal tear and tear to the vaginal, anal and the vulval regions, okay. So that pressure can be controlled, and like you can assess for the postpartum hemorrhage of the mother. Sometimes when this uterine bleeding is going to be severe, she can land up with postpartum hemorrhage. So you have to be cautious in preventing the mother from postpartum hemorrhage. See to that you maintain a sterile environment, because like any time the baby can be delivered. So the environment, the table has to be very sterile, and like when the head is coming fast, you have to always have a prediction whether there is a cord around the neck, you have to suspect, okay. And you have to use the slip off method, like to prevent cord compression you have to do. And then sometimes when the head is getting compressed also, you have to be very careful in delivering the baby. Okay, so now you have tried with all these maneuvers, the baby is coming out, the head is coming with lot of force, and you are you are giving a nice perineal support and the head is getting delivered. Okay, so now what you have to do is like support the perineal region, and you are supposed to wipe the face of the baby, and you will do a mild suctioning where you will be doing suctioning of the mouth and the nose, and wiping of the face has to be done, and then you have to make the baby relax. So as soon as you take the baby from the mother, immediately you have to assess the maternal side. So mother, you have to see where all the tears, like what are the damages that has been taken place, and like you have to prevent PPH, you have to arrange for blood and drips. You have to continuously, you have to start with IV fluids, it has to go, otherwise she may go in for hypovolemic shock. Then you have to assess, provide blood and blood products to the mother according to the amount of bleeding she has undergone. Okay, so this is with the management part, that is like during the onset and during the labor process. And then surgical management. So surgical management is your correction of your episiotomy. Okay, so in case if you would have given an episiotomy, well and good. Okay, because like you expect precipitate labor, some hospitals they in precautiously, that is like in an idea to prevent the tear, they give an episiotomy wound beforehand. Okay, in both the like mediolateral, you will be giving on both the sides, like to provide way for the baby to come out, so that the tear can be avoided. So if you have given episiotomy, you will be doing an episiotomy repair, or otherwise in case if it is a perineal tear, you have to assess like where till where this tear has gone, you have to assess, and you have to rule out the point from where it has started. So suturing has to be done continuously. Okay, so this is your management part from the mother side. Okay, so with this precipitate labor ends, like where we have discussed about the causes, risk factors from the maternal and fetal side, and then we have seen the signs and symptoms, management part during the onset as well as during the labor part, and the surgical management of the episiotomy repair. Okay, hope you understood the class. If you have any doubts, kindly give your comments in the comment box. Until then, bye.